I'm Skylar O'Tinker, and my project is on racial and ethnic health disparities in the oncology world. The reason that I was inspired to work on this project is that 2 years ago I was diagnosed with acute lymphoblastic leukemia with a Philadelphia chromosome. It's one of the most aggressive types of cancer. It's very fast moving, and so we had to act pretty quickly and come up with a treatment. So as I was looking over different options with my oncologist, he said something that really surprised me, which was, you're going to need a stem cell transplant, but don't worry, we think that you're going to be able to find a donor because you're white. And I was sort of like, what? Did I hear that right? My race means that I'm going to be able to have a cure to my cancer? That's ridiculous. If you look at this infographic over here, so these are different racial categories, and you see this column over here is white. That means there's a 79% chance of finding a stem cell donor. Other categories are not so lucky, and when we're talking about stem cell transplants, this is literally life or death. So if you're not able to find that donor, there's a very high likelihood that you're not going to survive the cancer. So I started looking at other types of cancer overall and looking at survival rates and initial diagnosis time, and found that these health disparities do exist with other types of cancer as well. So this brings up the question, is this due to genetic factors, or is this racism that is causing these huge disparities? And the answer is it really is both. An example that I can think of is the M19 gene, which controls pigmentation in your skin. If you have less pigmentation in your skin, then you are more likely to develop melanoma or skin cancer. However, because doctors are trained to identify skin cancer based on white skin tones, that means your skin cancer is probably going to be diagnosed earlier than people that have darker skin. And so that would be an example of institutional racism being a factor in someone getting delayed treatment and then having, poorer survival odds. An example of individual bias would be if a person's not feeling very good, they go to their physician, and they're a person of color, and their physician has a bias, they might dismiss the patient's concerns, and then that's going to lead to that patient getting diagnosed later and again having poorer outcomes for survival. So now it's not all totally bleak. There are some organizations that are making strides towards addressing these inequities. Recently, a new medical technique was developed where partial matches can be eligible as stem cell donors. So for people of color that have blood cancers, that's a really big breakthrough, and that just happened in the last few months here. So some, research centers and cancer treatment centers are doing important work to address these disparities. Some of the top takeaways that I found from analyzing those organizations are that we need to increase funding both for research and for treatment for BIPOC populations. We need to be partnering with BIPOC organizations as we are developing communication approaches to reach out to these communities. We need to be analyzing physician training programs so that doctors are graduating better able to take care of a variety of different types of patients. And we need to be coming up with innovative approaches, such as the breakthrough that I was talking about that allows for partial match stem cell donation. And another really important topic that I found was the need for data integrity, especially when doing research studies. So this infographic down here, which is looking at metastasis and tumor size upon diagnosis, they did not even have indigenous or native populations as a category of patients. So those patients definitely existed. How were they categorized? Did they just mark down a random box? We don't really know. It's really hard to compare the data when it's not all being collected. And if the data isn't representative of people's actual identities in the world. So that's another really important area that organizations can do better and decrease these inequities that we're seeing. Thank you.